I want to talk to you today about inflammation and kind of a brief discussion on how it impacts issues, specifically knee pain in this case, or hip pain, low back pain. It can also be a factor in plantar fasciitis and other any joint related issue. And this is what we want to talk about. There are two types of inflammation. One most people has experienced and is well aware of, and that's if you twist your knee or your ankle, it swells up, it gets hot and red. That's a normal body reaction. It's supposed to do that. Then your body reacts to that. It brings in blood cells and phagocytes and other cells to eat up that damaged tissue and restore it to normal health. If that process stops, then we're okay. But if it continues on, then you can develop tendonitis and issues with connective tissue. If it does not resolve itself and stop, it becomes a chronic inflammatory response. It affects your entire system. It goes through your whole body and is a silent killer in a way, because this is responsible for heart disease. It can be related to diabetes. It can be related to cancer. It can be related to Alzheimer's and just a lot of other diseases that you don't necessarily relate to inflammation. It's a silent type of inflammation. You don't feel it. You don't see it. You have to determine it by testing. And some of the things are blood tests that will reveal this, and another physical test that we do in our office that points towards that. Now, what causes it to proliferate and continue? The most common cause is the diet, is what is called the SAD diet, or the standard American diet, because it's loaded with sugar, oils, grains, and inflammatory foods. Now, the grains, is gluten. The oils are the trans fatty acids and the hydrogenated oils. The foods other than sugar would be things like dairy, soy, and eggs to some people. But soy and dairy are highly inflammatory, gluten from grain. And there is a class of vegetables called the nightshade family. And some people say, there's nothing to that. But I have seen it clinically in my office, so I know that there is. Nightshade family is comprised of potatoes, tomatoes, eggplant, tobacco, if you chew tobacco, and a berry called a goji berry. And I'm not too familiar with it, but if you are and you eat that, then that's going to be part of the problem maybe as well. And peppers, green peppers, hot peppers, red peppers, paprika, any pepper extract. Avoiding these foods will help to reduce that inflammatory response, and you will see improvement in joint symptoms, particularly chronic joints, even things such as RA and autoimmune problems. You avoid that sad American diet experience, get off of foods that are inflammatory, and you can Google this and see all these different lists of things. And you can also take turmeric. Now, turmeric is very common. I have a lot of people come in the office and say, I take turmeric every day. The active ingredient or compound in turmeric is called curcumin, and it is spelled curcumin. And it's that yellowish color that stains bad if it gets it on your countertops or on your fingers and so forth. It's extremely beneficial to reduce inflammation. A lot of studies have been done to verify that. The other is what is called an esterified fatty acid, and that's what we use in our office with our knee patients in particular. It is probably the most highly effective anti-inflammatory metabolic or nutritional form. So that is what can be taken if you want to do it. The other is to change your diet. And two diets that are highly recommended for this. One is called the paleo diet, and the other is the Mediterranean. And I didn't write it on here because I don't have enough paper to write that big word. They are typically high in vegetables, nuts, seeds, fruits, and meat. I would suggest you look into doing this. I know it's hard right now, this holiday season coming up. All kinds of cookies and pies and cakes and things like that. Make it a resolution right after the first of the year that you'll look into either the paleo or the Mediterranean. I've played with them, and I'm going full blast on the paleo come January the 2nd. So in the meantime, think about it, evaluate your diet and see if that isn't a factor. And adding curcumin specifically or estofat fatty acids can help reduce that, but you got to do a dietary management as well. So have a good day, and we'll probably talk to you before the holiday season is over.